Hi guys, it's me again. I'm here to share with you some survival tips that I have learned throughout this 5 months of our crisis. As much as I want to rant and talk about the frustrations we've been experiencing for the past few months, I want to keep this video as positive as I can. I made this video mainly to share my knowledge so we can all survive this crisis. Many of us realize that this year has been very exhausting, very depressing, and devastating for many people, especially for the families of those who died from COVID. So it's already August. I think we should finally get together and stop sulking and let's get back up on our feet. We have to help out in our own little way. So, first, I want to talk about giving. If you have the privilege to live a comfortable life, let's please try to hear the voices of those who are begging and crying for help. Let's make an effort, listen, and reach out. I know that everyone has the capability to help in their own little way, whether we use our skills or our talent, or by simply praying for others. Now is not the time to be self-centered. Now is the time to be more sensitive of the needs of other people. Don't just help out to make you look good. Just do it out of the kindness of your own heart. Next topic I want to talk about is masks. Okay, now you have a mask. It's great that you have one, but do you know how to wear it properly? Again, I'll be doing a demo of how to use a surgical mask properly. So this is a regular face mask. This is the colored part. So you have to wear it outside. And you have to pinch it so it doesn't fall down. Because if you wear it this way, the coronavirus can simply enter your nostrils, obviously. So this is also useless. Again, please do not wear your mask this way. If it falls down unintentionally, let me introduce you to the magic medical tape. So take your medical grade tape, there, it will not fall off your face. So if we have loose parts here, I also tape it. So there, you know that it's secure enough. I used to do this technique back when I didn't have those fancy masks, and when I didn't have an N95 and I had to perform, let's say, an endotracheal intubation, I use this technique and it works well. Before coronavirus, we had tuberculosis, we had HIV, we had many other infectious cases. So even way back, we really wanted to protect ourselves properly. Another point is when you remove your mask, let's say if you have to eat, you remove it completely, or might as well just change the whole mask, because some people wear it this way. The coronavirus touches the skin on your neck, you put it back on your face, then there you go, you get the virus. Just simply throw it out. When you remove a surgical mask, do not touch the mask itself. Just remove it by touching the ear loops, and then wash your hands. And it should be frequently changed. Better if we change it in between patients. So, for the other doctors out there, in performing endotracheal intubation, you're at most risk for contracting the virus because you face the patient with their mouths open. So you're really exposed. So, what other people do is they have this full face mask, which is recommended, and they tape it around so it is 100% sealed. If you don't have that full face mask like what I do, I use my O2 Canada mask and then a KN95 on top and then tape it so it doesn't slide. Of course, I use a face shield on top with my full PPE. So the next tip is for the other frontliners out there. In order to come up with a medical diagnosis, you have to do two things. You have to ask about their medical history and perform a physical examination. You first have to do an interview of the patient. You have to know what happened to them, what are their other illnesses, the medications they've been taking, any allergies, and other important information that we need to know to come up with a diagnosis. So, if I can communicate with the patient via phone, I'll do that from afar. Especially if they are COVID suspects, we interview them in a separate room with a glass barrier. So I just call them and then ask them about their history. So when I do my physical exam to complete the diagnosis, we don't speak to each other. I just don my PPE and then do my physical examination. In short, we have to keep our patient contact at a minimum. Next is the workplace. I noticed that I've been tagging COVID suspects mostly to people who work in an air-conditioned office. Like, for example, call center agents, managers, people from banks, people who are constantly exposed to crowds. Like, for example, if they work in a market or if they work in a grocery store, you're likely to get the virus. I want to point out that if you're in an air-conditioned room, the air that circulates is the air coming from the inside of the building. Unless you're in a special room that has negative pressure, so the air from within just goes out. So the reason why many patients usually get the virus from offices is that some people share the same equipment, like they share the same PC, keyboards, mouse that aren't even sanitized well. So I guess the solution for that is by just working from home. But if that is difficult, I guess a helpful tip is that you wrap everything with plastic so it's easier to sanitize. Let's say the keyboards, you can put plastic wrap on top so you can spray it with alcohol after each use. Another loophole that I think is very important is when coworkers eat together with their masks off. Everyone gets exposed to the virus. So usually what I do at work, I stay with people when they eat with my mask on, but eat afterward when they're all done. So I get to enjoy their company while they eat, and then after a while I spray the room with Lysol myself, and then I eat after 10 to 15 minutes on my own. In the workplace, I guess my biggest tip is that you clean everything yourself. I think it's best not to depend on the people who are in charge of cleaning the place, because you don't really know what they've been touching, and then they just end up spreading all the microorganisms everywhere. The important point is that we have to be mindful of the things that we constantly touch. For example, phones, car keys, gates, car handles, steering wheels, and the list goes on and on. You just name them all yourself and just make sure you clean them all. Sometimes we're not really conscious of what we touch, so now is the time to be mindful of everything that we touch. Another important tip is that when we do groceries, we have to understand that we're at high risk of getting the virus when we're in an enclosed space. So what I do when I'm in the grocery store, before I touch the handle of the push cart, I spray everything with alcohol and clean it twice. Wipe everything down before touching it. and then do my groceries as usual with a mask, goggles, and a face shield. By the way, I don't think it's necessary to wear gloves. Another point is that should you wear a full PPE when you're going out? I think it's enough that you wear pants, shoes, and long sleeve shirts. The less fabric that can gather the virus, the better. Please make sure to watch my other video. I will link it down in the description box. And I think it will be very helpful for all of us so we don't bring home the virus when we go out. I guess my last important points before I end this video is that if hopefully we survive this pandemic, and when you look back, you have to ask yourself, did you exert enough effort to help? What did I do to contribute to this world? This is our only chance. We only have one life. And nowadays, it's fair to say that it's a privilege to be alive. Me as a healthcare provider, I've seen it all. Seeing some of them die before my own eyes. I've seen some patients who come to the emergency room with no heartbeat, no blood pressure, meaning we have to revive them. And if you take their history, they were exposed to some healthcare workers that contracted the virus, that are COVID positive. Those patients have been well taken care of by their attending physicians for many years. Just because of a single exposure, everything will go down the drain and they just die just like that. So I guess it is my responsibility to voice out, ask all of us to help each other. I hope you learned something from this video. Thank you everyone for tuning in and giving me a chance to speak out. I hope everyone stays safe. Till my next video.